I never believed that it would be that successful. When I said it, I was looking at numbers and trying to figure out the traditional way, right? I was thinking about equity, the screening numbers and BMIs, and what happened was that people started helping each other across cultures, across races, and we have this healthy community, and the thing that astonishes me about it is that it's sustainable. When I was 13 years old, I had the great good fortune to meet up with some people in my small town in Ontario who were working with people living with disabilities. So I started at a very young age, and I started to organize a group of young people in my small town. But it broadened because I was acquainted with the work of Jean Vanier, who started what are called l'Arche, inclusive communities, where he basically said that people living with disabilities have the same rights and right to benefits as anyone in society, and he created communities around people living with disabilities, and he encouraged people who, so-called normal people, to live with them. And that movement has expanded to include 150 communities across the world. So as a young teenager, a very impressionable teenager, I was imprinted with this idea of inclusive communities, with the ideas of humility, respect, and equity for all people, even for people where it's a bit of a challenge to figure out how to include them in your daily life. With my partner, Chris Hallett, we decided that we wanted to do some work in community. But then we realized that we had to start with ourselves. We had to start with a self-examined life. It wasn't good enough just to talk community. We had to think about principles like just enough. We had to cut down on the number of cars we had. We had to walk around in community. In our own neighborhood, we had to pick up the garbage. We had to deal with the fact that there was crime on the streets and people weren't talking with each other. We had to introduce ourselves to our neighbors. We had to build a community garden, and lo and behold, things calmed down. We started looking just a little bit abroad to our expanded neighborhood, which is St. Jamestown. Now, St. Jamestown at the time had a lot of perceptions of higher unemployment, higher turnover, there was gun violence. There's so many negative perceptions that many people would not even walk through St. Jamestown in daylight, right? So there is something that had to be changed, not in the perception, but also in the reality of getting some services into St. Jamestown. Now, we had a choice. We could either move in the traditional way and raise money for services such as social work services, psychology, employment services, or we could build on what we had learned about our neighborhood and do community building. And we chose the latter route, to build community matters. Our notion of community in Community Matters was the recognition that communities are complex. Now, they're not complicated, they're just complex. We have to go in slowly and understand what is going on between neighbors. What are the strengths? What is the underground economy? What is the barter that goes on between people? The exchange of services. There's a huge amount of assets that are already going on, and it's our job to figure out what those assets are, because if we ignore them, we are ignoring a tremendous capacity of a community to take care of itself. And when I look at my training as a social worker, I was trained to be a professional. So the act of being a professional sometimes excludes people who could be doing some of those social work acts. And the same holds with education, health, and employment services. So sometimes, unfortunately, our services are divided into silos, those 4 areas, which make it difficult for the ordinary person to find access to them. So our job, or our idea, was to create community assistants in St. Jamestown, local residents who represented different cultures, different ages, different languages, who we trained to pick up some of the tasks of these different professions so that they helped to provide after-school services. They welcomed people for immigration. They supported people on their housing. They took seniors to the hospital. Basically, they were neighbors to other neighbors in their community. After we had worked on this approach for 15 years, we were lucky to be awarded a Public Health Agency of Canada grant for chronic health disease prevention. Now, you listen to that and think, how do you prevent behaviors that lead to chronic health challenges? I mean, that in itself is a big question. So the first thing that we thought about was screening. Let's see if we can address the issue of screening rates, at least, to show that we can improve the screening rates. And we thought, how do we do that? So we thought of equity, one of those principles I talked about right at the beginning. And so we said, if we can achieve screening rates that are as good as the rest of the other wards in Toronto, easily provable by City of Toronto data, then this project will have been, at least in part, successful. Instead of using the traditional approach, we tried the neighborhood approach. So, for example, I, as a traditional social worker, still tried a cancer support group at the beginning of this public health grant. It didn't work because we had 6 women. They all came at the beginning. 2 weeks later, 3 came, and then it dwindled down to 0 because nobody wanted to come through the room that led to our group room because everybody knew them. And they did not want their condition to be revealed to the community. You know, we have since worked with those women and other women who are living with cancer, and now 5 years later, I see those women participating throughout Community Matters. I see them in our celebrations, in our festivals. They come to spa to get their eyebrows done and their nails done. They come to socialize and be supported by their neighbors. And I know that that's part of their health maintenance program. And it could never have been done by them visiting a professional 1 hour a week. It is the way that we are encouraging women to come to a immigrant women's health bus, and our community assistants are explaining to them about that process of cancer screening, encouraging them to go, encouraging the follow-up. So it is the quality of the neighbors' support that is encouraging the women to get to the actual screening. And we have also uncovered a number of cancers, so they are also being supported through that process. I think that we have generated a healthy living neighborhood within the community of St. Jamestown. There's a group of women that get together every day to go for a walk. There's around the circle in Rose Avenue. There's about 15 different walking groups that have emerged out of that initial walking group that got started. We started a volleyball group from scratch. There are 45 players in that volleyball group, and now it's grown to the point that when other things have happened, the volleyball members are offering their homes to not only other members of their team, but other members of the community. So what actually happened? 20 years is a long time for something to grow and to germinate. And I go back to the poem that we talked about at the beginning, and I am astonished. The number of women I have seen transformed as community assistants over these number of years. Women who came who would say, oh, my English is not very good, or they'd cover their mouth because they didn't want me to see their teeth, or they would be looking down because they had been taught to never have direct eye contact with another human being, much less a woman or a man. And to watch these women, overcome all of these different fears and anxieties they have to kind of stand up and to learn and to grow and to make friends. And I know that they have jobs because we've helped them get jobs all around Ontario and now across Canada. And I'm so proud of these women and what they have accomplished. And I'm astonished by what they have achieved. And I'm also astonished by this community of St. Jamestown. Unfortunately, a few months ago, we had a horrific electrical fire that caused over 550 families to evacuate their homes. And they are still out of their homes. And, you know, you talk about community. The first people that were there helping each other were the neighbors, right? When we walked in there, people were giving water, food, blankets to each other. They were there. They knew where the seniors were. They knew where the people in wheelchairs. They made sure that they were brought down and brought into safety. When there was a second fire, not a fire, but sort of a flooding a few weeks later, we got a call and we climbed up to the 23rd floor of the building where there was no power, no water, no heat. It was in the winter, and we found two of our community assistants already there, and we could only illuminate them with our flashlights, but they were already there. The community was already there before the first responders, and that is my point about the future in this model. It is very precise and it's cost effective. It is the community. People care about each other, and they are the ones who are on the ground first. We supplement that with services and professionals, but I really think in terms of going forward, our faith should be in this notion of an oasis of decency that we have created with the principles we've talked about. That is, community matters.